Welcome back. There's some good news. Another batch of Johnson & Johnson COVID-19 vaccines has made its way to our shore. But some critics believe the government is not getting doses fast enough. And worryingly, health experts are warning of a third coronavirus wave. Applied Mathematics Honours graduate Sugan Naidoo joins us now to discuss the latest updates with regards to new cases, testing, healthcare workers being vaccinated, as well as national deaths. Sugan, always a pleasure speaking to you. Let's talk a little bit about how are we faring with the rate of tests that are being conducted thus far in the country.
Testing it's sort of stabilized in the last 2 to 3 weeks, so it hasn't gone up or down. It's been more or less the same. Only last week there was a spike in Northern Cape testing. I think there were some outbreaks over there. So if you look at the graphs, you'll notice that Northern Cape cases have gone up. So that's the only province where there's been a noticeable increase in testing. But with the rest, it's been more or less the same over the last 2 to 3 weeks.
But what does that say, though, about the rate at which we are conducting tests? And also, what does that say around the frequency of the reports that are coming out? Does that indicate that the provinces have become a little bit relaxed in the rate of testings and the rates of tests that they're conducting? Or that it just means that we're managing to finally put or get a hold of containment around the coronavirus and the spread thereof?
It's a little bit of both. I think obviously there's fewer people presenting symptoms now, so the demand for testing has decreased. But at the same time, I feel that testing shouldn't have decreased as much as it should have. I think there should have still been more concerted effort to test people so that we can identify problem areas before they become, outbreaks.
Yeah. Talk to us a little bit about the positivity rate.
Positivity has been going down, so all provinces are currently below 10%, but last week there was a slight increase for Free State, for Mpumalanga and for Northern Cape, so they're getting up toward the 10% now, and I think that's something that needs to be monitored over the coming weeks, because obviously if the positivity keeps going up, that's going to become a problem.
Yeah. I mean, positivity keeps going up, it's going to become a problem, but we've got this Easter period that is looming. We're currently in the midst of a long weekend, and time again, health experts have raised concern about this particular period, that they're afraid that it actually would result in a surge in the numbers. So in regards to that, what can you tell us about if we do not adhere to these lockdown regulations, if we do not adhere to wearing a mask and social distancing, that this could be the effects that we'll feel as a result of this long weekend period, as well as the Easter period that is coming?
Well, numbers have already started going up in some provinces. So if you look at the graphs there, Northern Cape, Eastern Cape and Free State, there's been a notable increase in the last week. And these numbers are going to keep going up in the coming week. So in some ways, the third wave has already started in a small way. And I think that if people don't take precautions now, these numbers are going to keep growing, because most provinces have stabilized to a point where they're not going down anymore. And at this point, you feel they're only going to go up from here. So over the next month, you're probably going to see a gradual increase in all provinces leading up to the Easter weekend.
Yeah. Talk to us about the Gauteng province. I believe that we've also seen a slight increase there as well.
It was up last week and it's come down over the last few days, but it's at a stage where it's not going up or down, but I feel it's probably going to increase in the next 2 weeks. I think that looking at the rate of testing, it's also starting to inch up a little bit. So that tells us that more people are presenting themselves with symptoms. That's why it's testing more.
Yeah. And also when it comes to the COVID-19 vaccine program and administering thereof, how are we faring when we're looking at the different provinces? We've got the Free State, Western Cape and the Northern Cape, for example, looking at the population that has been vaccinated thus far. Good results, bad results, or are we itching? Where are we standing?
It's basically negligible right now. I mean, less than 0.5% of the population has been vaccinated in the country. So with such a small percentage vaccinated, the effects on the third wave is going to be negligible. So basically, currently, the number of people vaccinated is going to have very minimal effect in terms of minimizing the third wave, because it's such a small percentage. It's basically nothing. So people need to realize that because there's such a small percentage vaccinated, the risk is still high going into the Easter weekend. So people need to take precautions and not think that, things are okay now because numbers are low, because obviously complacency will lead to these numbers going up again.
Yeah, I mean, I'm just looking at the numbers, for example, the likes of Mpumalanga, where we've got about 9,877 vaccines that were administered, and that was figures showing as of the 18th of March. That says something about even healthcare professionals that are putting up their hands to get vaccinated. The likes of the Northern Cape as well showing low figures. Is this indicative of the number of healthcare professionals that are apprehensive about getting the jab? Or is this indicative of just the number of healthcare professionals that are dispersed within the various provinces and therefore getting the jab?
I don't think healthcare workers are against getting the jab. I think it obviously comes down to the number of vaccines available is not that high. We don't think it's just over 203,000 available right now. So obviously the number available to each province is limited. And the distribution also has been quite slow. So I think that's been the main factors in why the numbers are so low at the moment.
Yeah. With the numbers that are presented before us, Sugan, are we likely to reach our goal of herd immunity anytime soon?
No, I don't see that happening. I don't see it happening before the third wave hits. I think that herd immunity is a long time away. I think it's going to take months probably before we reach that. So people need to obviously take precautions because the risk is still very high out there.
Yeah. And when you're saying it's a few months away, does that mean it's likely to be reached in 2022 and not necessarily 2021? I
think that's a more realistic view. I think reaching herd immunity this year is very unlikely.
We'll leave it there. Sugan Naidoo, applied mathematics honors graduate, giving us the latest figures there, tracking those figures of us for us where vaccination is concerned, as well as what it looks like from a COVID-19 infection rate. Well, to this story now.